Dear audience, let me introduce my project progress. The title of my big PhD topic is Clinical Pathophysiology of Polycystic Ovarian Syndrome. My name is Rita Vajna. I am a PhD student and a specialist in obstetrics and gynecology on the Barrow Street Department in Semmelweis University. My mission is to find the best therapy option for higher ovulation rate, endometrial thickness, and pregnancy rate in women with PCOS. My vision, with the best therapy, more women with PCOS can have a child. There is my specific goals. The title of my first topic is Strong Early Impact of Letrozole on Ovulation Induction Outperforms Clomiphene in PCOS Women. First, I would like to speak a little bit about the background. The incidence rate of PCOS is between 3 to 10%. The PCOS is the #1 cause of infertility. The most important problem with this high testosterone level that leads to irregular periods, and finally it leads to infertility. We have two good PCOS options for follicular stimulation. The first one is clomiphene. This is an estrogen antagonist, but this drug has many side effects. The most important is endometrium thinning. We have an alternative option. The name of this drug, Letrozole. This is an aromatase inhibitor, and Letrozole doesn't show anti-estrogen effect. Our clinical question is Letrozole superior to clomiphene in treatment of infertility in PCOS patients? Our hypothesis is Letrozole therapy is superior to clomiphene therapy. I made the systematic search with the following search key, and after the selection, I found 25 eligible full text. I would like to show you my results. The first one is endometrial thickness. We can see on this forest plot that when patients use Letrozole for ovulation induction, the endometrium will be thicker than a patient use clomiphene. The mean difference is 1.7. This is statistically significant and clinically relevant. My second result is ovulation rate. We can see on this slide, Letrozole using patients have bigger odds for ovulation than clomiphene using patients. The odds ratio is 1.8. This is statistically significant and clinically relevant. My third result is pregnancy rate. We can see that Letrozole using patients have bigger odds for pregnancy than the patients who used clomiphene for ovulation induction. The odds ratio is 1.96. This result is clinically relevant and statistically significant. My last result is resistance index and pulsatility index of subendometrial arteries. We can see that the Letrozole using patients have lower resistance index and lower pulsatility index of subendometrial arteries than clomiphene using patients. And this is good because when the resistance index and pulsatility index is lower, in this case, the circulation in the uterus cavity is better, and therefore the embryo implantation will be better too. The summary is our strength was we used only RCTs to our article, and this is the first meta-analysis to comprehensively assess the resistance index and pulsatility index of subendometrial arteries. The limitation was we doesn't have sufficient data on live birth rate, and different drug doses were used across the studies. The conclusion is thicker endometrium, higher ovulation and pregnancy rates, and better subendometrial circulation was in the Letrozole group compared to clomiphene group. Our summary is urging the implementation of Letrozole for ovulation induction in clinical practice, but more studies are necessary reporting subendometrial circulation data. This is my first manuscript status. My fifth expected submission date is January 29, 2024. The title of my second topic is investigating the efficacy of natural products on metabolism and on endocrine status in women with PCOS. That will be a systematic review and meta-analysis too. The background is very similar to my first project. We can say that when the PCOS patients, besides PCOS, have obesity and insulin resistance too, it leads to finally infertility and diabetes mellitus. In this case, the first-line treatment is metformin, but metformin has many side effects. But natural products can enhance the positive metabolic and endocrine effect of metformin. And finally, less metformin might be sufficient. Our clinical question is, can natural products improve the metabolic and endocrine status of PCOS patients? The clinical implication is natural products as an effective therapy to improve the metabolic and endocrine status in PCOS patients. I made a systematic search with this search key, and after the selection, I found 34 eligible full text. This is my second project progress, and I can show you preliminary results. The first one is energy and BMI between patients treated with only omega-3 or only placebo for a maximum 6 months with their usual physical activity. On the right side, we can see that energy will be significantly lower, and the BMI will be lower among omega-3 using patients after maximum 6 months. This is lower than in the placebo group. My second result is glucose level. We can see on the right side that omega-3 using patients after maximum 6 months have lower glucose level than the placebo using patients. My third result is HOMA index. And we can see that among omega-3 using patients for a maximum 3 months with the usual physical activity, the HOMA index will be significantly lower than among in placebo group. My fourth result is HDL and LDL laboratory parameter in this group. In these two groups, we can see on the right side that HDL level will be lower and LDL level, HDL level will be higher and LDL level will be lower among omega-3 using patients for a maximum 6 months with their usual physical activity, and this is better than in placebo group. This is my summary, and thank you for your attention. And I would like to close my presentation with the following sentence: what you can't explain simply, you don't quite understand. Thank you very much.
Thank you. It was a very nice presentation. I have a question that is there any side effect of the letrozole?
Yes. A side effect is lower in letrozole group compared to clomiphene C3 group. With letrozole, the patients have perhaps hot flushes, some vasomotor effect. Yes.
Okay, thank you.
Thank you very much.
I also have a question about the complications that, in comparison for your first study, that with the letrozole and the clomiphene citrate, is there any difference with the hyperstimulation, or did you investigate that? Mm-hmm. So it's an important question.
Thank you for the question. We don't examine the OHSS. But I read that with the letrozole, the patients have not lower OHSS syndrome than with clomiphene citrate.
Thank you. My other question is that in your second study, that what was the dose of the omega-3 which was proven to be effective in these studies?
Yes, not the similar during the studies, not the similar. 3 capsules, perhaps, yes. This was the average, yes. Thank you.
Do you use Letrozole for ovulation induction
In
your personal practice?
No.
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 And do you know how should we use it then?
How?
How? So
Yes.
because
Yes, on the menstruation, from the menstruation 2 day bis menstruation 5th day, and how many?
what is the dosage?
How many
Yes.
tablet? In the literature was not the similar dose, but I think it was 4 tablets per day.
2.5 milligram, 4 tablets per day. Yes.
Yes.
Okay.
Thank you very much.
Thank you.
Thank you.
Thank you. I have a question. There was a huge, vast amount of studies on omega-3 and its effects on metabolism and energy and the levels of everything that you showed. How did your results align with this well-established previous evidence due to HDL levels, energy intake levels, blood sugar levels? Because as far as I know, only with over 2,500 units of DHA, so omega-3, was effective only in minor reduction in HDL. But as far as I saw, you didn't have any significant results as well, right?
This was not significant. Only the HOMA index and only the energy was a significant result.
So all of the others were basically scattering around 0, right?
Yes. I don't know why was the other result not significant.
Maybe because there is no effect.
This is only this is only the preliminary result, and we hope the.
And this, so my question is that this HOMA index and the energy levels are aligned with previous studies findings.
Yes.
About omega-3?
Yes.
Okay.
Thank you.